Overdosing on opioids have killed many people here in Utah, but the tide is turning thanks to groups like Utah Naloxone. They saved the lives of more than 3,000 people. So here to explain how is Jennifer Plum with Utah Naloxone and Patrick Rizak here from One Voice Recovery. Guys, thanks for being with us today.
Thank you for having us.
So how serious is Utah's addiction to opioid drugs?
Yeah, Utah has really struggled with opioids. In fact, our death rate has been as high as 4th in the nation. Thankfully, in the last 5 years or so, there have been really concerted efforts, and we've been able to improve that. By 2017, Utah was one of only 7 states that showed a decrease in our opioid overdose death rate, but it is still really terrible.
Why is it so bad here?
You know, there's a lot of factors that lead up to that. Some of it is prescribing patterns. Some of it is an inability to admit when anything's wrong, or a fear of admitting when anything's wrong. And it leads to a lot of people who don't realize how in dire need they are of help.
So how has Utah Naloxone helped to save their lives?
Yeah.
You mentioned the decrease.
Yeah.
How are they doing it?
So we set out to essentially change the dialogue, to get people talking about risk factors, as well as to provide them with naloxone, which is an opiate antidote. If someone overdoses on an opiate and they get naloxone, you can save them if you get to them in time. So we set out in 2015 with partners we have at One Voice Recovery to get people equipped so that folks would not die.
So this is a life-saving drug, and you partner here with One Voice Recovery. Where's your part in this in helping save some of those people's lives?
So we really focus on working with people that use drugs and getting these kits out to people that maybe wouldn't access them otherwise. So we use our syringe service program, and we deliver to people. We work in rural areas. We have an office in Price, office in Sugar House. So we've enrolled about 1,100 people in our program. All of those people are active, drug users. And so we really focus on getting those kits to those folks.
Is it pretty widespread across demographics, age ranges, parts of the city? Or is there parts of the city that are more susceptible to others that you see with your work?
We see people in Daybreak. We see people downtown at the Road Home area, Rio Grande area, North Temple, Draper, Weber County. So there really is no specific area where people are more prone to overdosing or using drugs. It happens everywhere.
So if you're someone who's watching at home, you're thinking, okay, I'm addicted to some of this stuff. I need some help. What's the first thing they should do?
Well, and the first thing people should think of is that opioid substances are in their home, period, whether they're prescribed or otherwise. They need to have naloxone. Anyone who's exposed to those substances, to include children that are around them, should be equipped with naloxone. They should reach out, talk to organizations like One Voice Recovery. They can always reach out to us, get equipped, and then let's start the dialogue about what it would take to have you be in a healthier place. It's really about any positive change.
And Patrick, you mentioned you connect people. What if there's someone at home, they have a loved one who's addicted? Where do they begin?
They can call us. We've linked several people to treatment. We have a lot of partners. So we work very, very hard to link people and get them placed in treatment when they're ready.
Okay, so we need to know the places to go here. If someone's online, they can find you. I know they can. What's the websites they should search for?
OneVoiceRecovery.com.
And UtahNaloxone.org. And we really are confidentially, completely available to help anyone who would like to even just talk.
I'm glad you're getting the help to the people who need it, guys. Thanks for being with us today. We'll have a link on our website at abc4.com. Talking this morning here with Patrick Rizak here from One Voice Recovery and Jennifer Plum here with Utah Naloxone. Guys, again, thank you for being here this morning.
Thank you for having us.